Good afternoon. I'm Mark Roper with WMAR-2 News. June is Men's Health Month, and today we're talking about good mental health for men. And I'm joined with Quinten Askew, the president and CEO of 211 Maryland. Good afternoon, Quinten. How are you today?
I'm great. Good afternoon. How are you?
Good. As I said, introduced you to say that we are talking about mental health today, but mental health is really one of those things that a lot of people almost don't like to talk about.
Mm-hmm. No, that is definitely true. And I think part of that is really because of the stigma that has been around it. And I think one of the things that we've been seeing recently is that there's been a lot of work to really destigmatize what mental health is.
And with this being Men's Health Month, how difficult is it for men to actually reach out and get help?
I think, especially for some of the work that we're doing, it is kind of difficult, especially someone who's experiencing it within family of watching individuals with mental health and other male counterparts. I think it's difficult, one, because of a lack of understanding, really what mental health is. I think a lot of times as men, we may look at things of, feelings instead of really emotionally how well I'm doing. And so I think that really sometimes puts a barrier in us really seeking help at times.
And how do you break that barrier with men to get guys to talk about their feelings? It's not something that we really do that well, I should say, or that often.
No, you're absolutely right with that. And I think it really comes down to, really relationships, education, I think, which is really important, and the lack of awareness. I think for us, as men, really understanding what mental health is, how it really affects us, holistically. But I think the more that we're really educated about it, more information that we can get, that really helps us to open up about it.
And what are some of the ways that you can kind of put men at ease to, I don't want to say force them, but help them open up and talk about their feelings?
Yeah, I think conversations, just really conversations of asking basic questions of how are you? How are things going? How are the family? And I think, really starting with those, loved ones and friends and others that we care about, just really asking those basic questions of how are you, to give the other individual a chance to really talk. I think a lot of times, the really basic questions are things that we really like to answer or ask each other.
And what are some of the main concerns that are facing men when it comes to mental health issues?
I think for us, really, dealing with, social norms. I think which is one of the biggest ones. Really, us feeling that we have to be perceived at a certain way. We are the men of the household. We have to be strong, for the family, and sometimes that really doesn't connect or adapt with, my mental health. That I may not be feeling well, or I may be feeling depressed, and sometimes that translates to weakness in this for us. But I think, a big role in that is really, destigmatizing it and helping us understand as men that it's okay to talk, okay to have these feelings, and for us really to communicate and express what those are.
And how do those feelings manifest themselves in our behaviors?
You see it consistently where it manifests, through our work, through our family and interactions with children and other family members, or through spouses. Where it's anger, where it's the depression, where it's worries about money or finances, and it sort of just overflows. And I think that's really a lot of times where we may not understand where these things are coming from, because we've been dealing with that trauma for so long. But it manifests its ways in many ways as possible.
And how do you help guys deal with those issues when you're focused on the mental health, but you can't necessarily cure the aspect of dealing with their financial issues or dealing with, say, physical health issues that may have an effect on their mental health?
Mm-hmm. That's absolutely true. And I think one of the great things that we are able to do at 211 Maryland, and with our great network of call centers, and for anyone who's seeking help and contacting us for mental health support, especially through our 211 Press 1 crisis line that supports mental health, is that it's approached from a holistic perspective. We have a great group of call center network partners that are able to focus not just on the mental health aspect, but also what are some of the other supports you need, whether it's food or financial support or employment. I think we're able to really take that holistic approach.
What would you say constitutes good mental health? Like, how do you know when your mental health is at a good point or a bad point?
Mm-hmm. I think that's a great point. I think sometimes we know something is wrong when we are isolated. We tend to stay away from others. emotionally unbalanced when, maybe we are angry, when, there's arguments with friends or family members, just some of the consistent things that we do are no longer consistent. I think those are signs that, maybe something is wrong. And a lot of times, again, I think we look for physical things, as men, instead of really, emotional, how I'm feeling. But I think, when we tend to have a shorter span of, communicating with someone and angry at other individuals, those are really signs, I think.
I mean, when you talk about isolation, I hadn't seen friends in person like most of us probably for, I think, at least over a year. And I saw my mom for the first time in, I think it was a year and a half practically because of the pandemic. So, I mean, we've all been isolated over the past year.
Yeah, absolutely. And unfortunately, that is what COVID has done for us. It has forced us to be isolated to stay well. And so that was one of the first things that they told us to do, really, stay separated so that we can be well to get together. And of course, that's separate individuals from loved ones, family members, and also from their other emotional supports, whether that's counseling or treatment. One of the great things we were able to do as a result of COVID in partnership with Behavioral Health Administration was to set up a texting line. And so it's MD Mind Health. So anyone can text MD Mind Health to 898-211, and they are able to get sort of consistent texting and mental health support. So, we've been able to create ways to keep individuals connected, or at least, stay informed.
That's MD Mind as an MIND?
Yes, MD Mind Health. Just text 898-211 MD Mind Health, and they're able to subscribe to get weekly text messaging, encouraging messaging, just really to stay connected to resources that are out there in the community.
What are some examples of those weekly text messages that you might get? Are they just kind of like checking in to see how people are doing?
Yeah, it's check-in reminders to say, hey, how are you? Did you go for a walk today? Here are resources that might be useful for you, whether it's mindfulness resources or how to exercise better. All those resources as well redirects you back to contact 211 if you're ever in need. And so it's really just an opportunity to keep someone engaged, because we all have our cell phone. And we know that, we're connected, through a cell phone, but it's an opportunity really to have sort of a case manager or support person in your pocket.
What are some of the types of issues or circumstances that you help people who call 211 with?
So we get, individuals who are calling us who are in crisis, who are, just in need, or individuals who really are looking for just someone to be an empathetic listener. And so a lot of the times for individuals who call, it could be from anything for, I need to find individual counseling support, or I want to commit suicide because I'm dealing with so much. And so there are a variety of reasons that we get calls for 211 or our 211 Press One line. But again, we have a great group of call center networks who are accredited and certified in providing this crisis management and suicide support to individuals. It's available 24/7, 365. And so, we really have individuals who are able to, not just by phone, but also by text. And so, you can text with us, you can chat with us, but we think it's important that individuals have a variety of ways to contact us so they're able to connect the way they feel most appropriate.
And suicide seems like one of those issues that has a huge stigma. It's bad or hard enough for people to talk about mental health, but I think very few people will tell you, yes, I have thought about killing myself, or I tried to kill myself. How do you help people who are going down that path?
Yeah, and so, there's, men are really, the greatest risk of suicide, but really less likely to seek help. And I think, again, our call center network does a great job of being an empathetic listener, but also understanding when, this is an emergency and we need to contact with other emergency supports, whether it's a mobile crisis team or other emergency management individuals in the community. And so it really comes with, one, making a connection and building the relationship with the individual who's calling. Because again, that individuals are isolated, they're alone. And really, when they're calling, they're in crisis, they really reach their last point of, I don't know what to do. And so it's really our role to be able to be that support and that connector in the community to say, there is help, we are here to help, and there are resources out there for you.
And I know that you're not a clinician, but do you know what is it that drives someone to that point? you said that they may feel that there is no help. Is it that hopelessness that ultimately has someone considering taking their own life?
I think it is that hopelessness, that overwhelming. There is, just daily life. I think that, especially with the pandemic and just daily life, whether it's employment or overwhelming with finances or family, and just really not knowing, or understanding, what resources you have, and just feeling like I can't do it anymore. And so that is really where, it comes to our job to help individuals understand there are resources that are there in the community. There is help, but it really comes down to individuals just feeling like, I don't have any other choice. And so we really want to let individuals know that, there is choices, there are options, there are individuals who care about their well-being.
And it's sad that anyone would actually feel that they are at that point where they have no other choice, where they're at the brink of taking their own life. But sometimes you hear cases where friends and family are totally caught off guard, where they had no idea that their loved one was feeling this way. Sometimes there might be cases where you could see hints that people may be dropping, or I don't know, do people always drop hints and maybe we just miss them? But it seems that there are sometimes very unfortunate cases where people say they didn't know and they wish they could have been there to help.
Yeah, we do hear that a lot and see that, because sometimes the behavior changes are really not noticeable, or because we feel like we know the individual that that may not, that's just them that day, or that this is not a behavior that is lasting. And so sometimes it's difficult, because even as a family member, you may not understand how to help or signs of what to look for. And I think that's where it's important for that education piece to come into play, for us to really understand, what is mental health? What are some signs that we can look for? And it's, whether someone's becoming isolated, or, they've become depressed and just not speaking or calling or just doing the regular things they normally do. I think those are all things that we really should pay attention to now.
And is there anything that we can do as people who are concerned for our loved ones or friends, when you hear or see those warning signs? Is there anything that we can do? Because I think even when you hear that, you don't want to believe that the person that would even consider that. They may say, like, especially maybe someone who's been out of work. I'm tired of being out of work. I haven't been able to find a job. Sometimes I feel like I just want to kill myself. And you might not take that seriously, when a friend or loved one says that to you. So at what point should we take that seriously, and what should we do about it?
I think we always should take it seriously. And I think, even if we don't know what to do, I think, doing nothing really shouldn't be an option. I think we should always, try to engage the individual, but also seek out for help. And especially, we're really uncertain, you just really calling, whether it's, another friend or local, doctor that they are connected to, or even just contacting us at 211. Or 211 press one at our crisis line to say, hey, I have someone, a loved one, a family member, I'm not sure what to do. And so we have trained individuals who are able to walk through the process and provide, great feedback and support of how to help the individual, or to really connect them and ensure that they get help. But I think, we should take it seriously. We've seen, too many times now where, individuals has been successful with taking their life, but, there are resources there, especially, just like 211. And other services that we have, NAMI and other resources that are available.
So what are some of the resources available in Maryland that people can reach out to for help?
Yeah, and so, again, you have organizations like NAMI Maryland. You have, of course, 211 Maryland, where you can call. Again, and our role is really anyone who is within, Maryland can just simply dial 211 and really get connected to any of the resources across the state. And so if you contact us, based on your zip code and what your need is, we can really connect you to a mental health resource right in the community, right in the zip code, whether it's a couple of miles from you or right down the street. And so really just contacting us will really give us an opportunity to provide you a resource that's close to you. Contacting our crisis line, which is 211 press one, will give you immediate access to a crisis specialist. And so again, this is someone who is trained, certified, and able to really support you in that mental health crisis, or really just, uncertain of exactly what you're going through, but just someone to be able to talk to and say, here's a resource for you, or here's how I can help you.
And these are some resources that are available for people to actually speak with someone in person, not just over a phone or through a text.
Correct. It can be in person. It can be over a phone if that's the individual's preference. Telehealth is a big thing now with individuals. So we can provide a resource, whether it's in person over the phone or online. So we are able to really provide a resource that's close to the community where the individual lives.
Are there any success stories that you can share? I mean, obviously not mentioning people's names, but some general success stories that you could share.
Yeah, definitely. We there are several success stories throughout the centers where individuals who have called who were in crisis and now who have begun to volunteer for the centers that they have utilized for the support. Individuals who again have contacted us and have been referrals for the 211 or the 211 press line, because this has been a resource or support that has really helped them. And I think one of the most important things of contacting the line is that it gives the individual an opportunity to build a relationship, to build a connection. Again, because we're 24/7, 365, we're always available. And so, whether it's midnight or it's 6 a.m. in the morning, there's someone there to answer the phone when they're calling. And we really try to make it convenient, whether it's, hey, I don't want to talk to someone on the phone, but I'll be willing to chat online. Or I don't want to chat online, but I'll be willing to text someone because, I may be a younger adult and we're more familiar with texting. So we really just provide a comfortable way to connect to individuals who are in need.
How busy have those phone lines been over the past year?
Wow, since COVID, our numbers have almost tripled. Last year, we supported over 400,000 individuals across the state. Maybe close to maybe 25 to 50% of those individuals were related to mental health, suicide, and crisis supports, especially in our Southern Maryland region. So there's definitely been an uptick in individuals seeking support for mental health and crisis services, which is good because we want individuals to be able to reach out. We want individuals to understand, that mental health is not a bad word, that we want to be able to help to remove the stigma around that so that you're comfortable with really reaching out for help and getting the help you need.
What was the cause for, or the root cause of most of those calls that you were receiving? Was it from many people who may have lost their jobs during the pandemic, or was it from people who were cut off from friends and family?
Yeah, so it was really a culmination of a lot of things: losing a job, losing finances, not being able to see their loved ones, being isolated from work. Again, not being able to go to work or just function or really be connected to their service providers, because we had a lot of individuals who were seeing, whether it's a therapist or a counselor, and they had weekly appointments or monthly appointments. Now in COVID, those appointments have stopped. And so, we became a resource when they were not able to really get out to the appointments, that really kept them afloat and really kept them, ongoing in a positive way.
Are there some mental health stats that you might have that you would want to share?
Yeah, I mean, just last year, from last January to March, we had over 10,000 individuals seeking help for mental health and substance use. And again, as previously stated, a lot of those were coming from our Prince George's and Frederick community. We noticed that a lot of our higher requests, individuals between the ages of 30 to 39. Which is very, very interesting. Again, the highest call by individuals who are in crisis, first white males and then African American males who were seeking help. And so again, it's important to know that individuals are reaching out for help, but we know that there's many more that are out there that could use some support.
Do you think it's harder for African American men to reach out for help?
I think so. I definitely think so, especially with the stigma for African American men. And I think, again, for us not really understanding and knowing what mental health is, and especially being able to speak for myself, until I was able to be in the field and understand and appreciate it, not knowing what those feelings were that I was feeling, as a young adult, as a younger man growing up, and how those things may have manifested into other ways. And there's also not a lot of communication or talk within some of our families about mental health or seeing a therapist, because there may be a lack of funds, financial support, or a lack of health insurance to be able to connect with the provider or even providers in our community. And so I think all of those play a role in, especially with African Americans seeking help.
And as we've said, or we've been talking, that there's not only the stigma surrounding mental health, but there is also sort of a stigma just in terms of getting help. If you were to tell someone I'm seeing a therapist, sometimes I think people have a certain reaction to that.
Yes.
If you were to tell friends or family I'm seeing a therapist, there might be, I don't know, a hesitation or some type of, the wheels start turning in their head where they start thinking, I wonder what's wrong with them. But it does take a little bit of courage, I would say, probably, to see a therapist.
Yeah, I think it takes a lot of courage. And I think that, especially like you said, being able to, I think one, not being afraid or ashamed to say, I'm seeing a therapist. Because again, whether it's friends and culturally, we look at that like, what's wrong with them? What's going on? Why can't they support themselves? And I think, if we begin to remove that stigma and be more comfortable with having that conversation, I think it really opens the door for others, our other peers, other friends, and other males and loved ones to do that. But I think it's really having the comfortability to have that conversation and really say that.
And one question that we have here is, what about the mental health of the young men in our lives who have missed school or sports? Are there different signs to look for? Again, with people being isolated over the last year, and kids, as adults, we have learned, maybe some of us, or maybe not, how to deal with certain situations. But for kids, obviously, the last year definitely took a toll on them as well. Not being in school, not being with their peers, not being able to do the things that they're used to, where it might be, or I'm assuming maybe, is it harder for kids to roll with those punches? And how do you know what to look for to help them?
It is, because I think even our youth really don't understand, again, or able to articulate and express how they're feeling. Someone who's a coach as well, that was one of the hardest things, not being able to gather with the youth that we were working with, whether it's on the basketball court. And so I think with youth, a lot of the signs is really looking for that disengagement, not wanting to talk to the friends, not really wanting to engage with the friends over the phone. And really not wanting to talk about, a lot of the day-to-day activities that they normally are involved in. And so, we had a lot of opportunity to have a lot of great conversations with some of our young athletes as a part of our youth program, really on Zoom. So a lot of things we were able to do is really get the team members on a Zoom to say, hey, let's just get together and just have a conversation to check in. And I think that's really important with our young people, is just really to continuously check in with them. Because, as someone who has young ones, they sometimes don't know how to articulate, or really don't want to articulate. And I think it's really up to us to make them feel comfortable to say, well, I'm not feeling well today, or I'm not sure exactly what's going on. And that really opens the door for them to have that conversation. And again, I would encourage really anyone, whether it's a youth, parent of a youth, to really, not knowing, to really contact us and really connect with us to see what their supports are for themselves.
Well, you can ask a teenager, how are you doing? What's wrong? And the answer that you'll probably get back is nothing, or
nothing. That's it. Yeah, it's always a nothing, or I'm fine, and nothing's wrong. And I think that continuously pushing or engaging with them, it is helpful. But at least just making them aware that if you need to talk, I'm available. If you need, some other support, here are some resources for you. And whether it's, a YouTube video that talks about, mental health for youth, or other things that they are able to connect with, I think it's really helpful. But it's really that continuous engagement and checking in with them, because that's important.
And how do you walk that fine line between pushing, but not pushing too hard where you push them away, pushing to show that you're concerned, or showing concern, but not pushing them away?
Mm-hmm. Yeah, I think that is a very fine line. And I think whether that's a daily check-in, hey, how are you doing? Is there anything that you need? Or here's a great video that I saw that really, maybe talked about some things related to, they're in sports, really talks about things that's related to mental health in sports. As we see now, a lot of our athletes are really talking about, their mental health and some of their experiences. And I think anytime that we can connect our young folks with someone that they have an interest in, whether it's an athlete or an entrepreneur that is speaking about, important topics like mental health and other things, to try and connect them with that information and share those videos and share those resources with them, because I think it's helpful.
And we have another question here. The mental health as being a cancer patient, having to keep from others, and now depending upon whether others are really vaccinated and not using masks, I still feel I need to wear mine to protect myself.
Mm-hmm. Yeah, and I think that, especially as the times we're in with COVID and still uncertainty, is the first thing is that, really doing what's priority and best for you. And that's continuing to wear masks, that's continuing to provide and get the information and resources that you need that are helpful. But I think, it's really doing what's best for you first.
Because the pandemic has raised a level of stress, I think, in all of us that we did not expect or could never have imagined, from not only the virus existing, but how we dealt with it. Just as the last person who asked that question, there's a whole other, I can't think of the right word, whether it's nervousness and not knowing, am I safe in this situation? Is this situation okay to be in? Most people, or many people, are vaccinated. The state has passed over the threshold as things are now starting to reopen. As of July 1st, we'll pretty much be somewhat like back to normal. I hate to use that word, but it looks like we are going to be pretty much back to normal as of July 1st. But, you know, some people may feel like mentally they're still not there yet.
Yeah, no, and I think that will take some time because, again, it's been over a year and we've been isolated. We've had to wear masks everywhere we go, which is not normal that we've been used to. Really engaging and thinking about, you know, is this person vaccinated or they're not vaccinated? And if I am, you know, what are these things that I can get? And I think there's been so much information that we have been receiving. It's really difficult to understand, you know, what I should know, what I should believe. And I think first and foremost, we really have to do what is best for ourselves, and really that is best for our particular family. And I think that there is a lot of information there, and it's really, you know, upon us to really continue to find the information that, you know, that helps us to understand what it is that we particularly want to do. And again, I would welcome anyone to really give us a call if they're still not sure of, you know, some of the mandates that are going on, and, you know, where are some places that I can go or get information related to COVID and mask wearing. Calling 211, we can also provide that information.
What do you hope that guys get out of the conversation that we're having today?
That it's okay to talk about it. That it's okay to have the conversation. It affects everyone. It has affected me, family, children. I think it really, that it's okay, that help is available. There are organizations and individuals out there who care. But I think the most important part is that, you know, it's really important for us to understand that, you know, it's okay to talk about it, and really seek help if it's needed.
And what constitutes good mental health, in the sense that there are things that we can do to, say, deal with everyday issues, but there are some mental health issues that need treatment, say with drugs or therapy, beyond say just picking up a phone and asking someone for help.
Yes, correct. And so there are, you know, whether it's someone is suffering from a substance use concern, whether it's, you know, dealing with opioids or other drugs, or someone who's dealing from a serious mental illness, there is, you know, there is help there. And again, I think really connecting with a crisis specialist, whether it's through our 211 Press One line, connecting with an organization locally that can help support, whether it's, you know, individual, inpatient, or outpatient counseling. I think the most important thing is that, you know, if you're not feeling okay and you're not feeling well and not sure what to do, is the first thing is really to seek help. And really from that help, I think you're able to get the information and the resources and the connections that you need. But it's really being okay to really ask for help and to seek help when it is needed.
And we're almost at the end of our half hour. If you want to give people sort of a rundown in terms of where they can go reach out for help, what are those options again here in Maryland?
Yeah, absolutely. So anyone can contact, if they're looking for assistance with any of their basic needs, they can contact 211. If it is a crisis or mental health or a substance use need, dialing 211 and press 1 will get you immediately to someone, a crisis specialist, for support. Individuals can reach us by text, by easily texting their zip code to 898-211, or really just going to our website, and that's 211md.org, to get any information, any resource. You'll find a plethora of information there related to COVID and other supports. But again, you know, 211 is a free, confidential, supportive resource that is here for the state, for anyone that is in need, 24/7, 365.
Those are very important points. One, that it's free and available 24/7. I think those are things that appeal to a lot of people who want to know that.
It's a quick and easy number, 211.
Yeah, very, very easy to remember. And just one last thing, as we are moving closer to everything reopening and the emergency orders being dropped as of July 1st, you talked about how there was definitely an uptick in the number of calls that 211 handled. Have you seen things ease off as the restrictions ease off? Have things kind of slowed down a little bit, or are things still running out? As you know, we just got a question where someone was still very concerned about their physical health in terms of the pandemic. So have things eased off as the restrictions have eased off?
No, things are pretty much really staying steady now, because as we loosen some restrictions, there are still questions of, well, what do I do next? And so we still see those calls coming in.
Well, thank you, Mr. Askew, for joining us today and for giving all that information for where people can reach out for help. Again, you can call 211. It's a very easy number to remember. And thank you for watching, and have a great day. Thank you.
Thank you. Thank you for having me.